Most likely, if you're experiencing neck pain, you're going to have symptoms in some of these areas. It might be in the upper trap, it might move up into your head. In some people, it wraps all the way around towards the eye, or some people just feel it behind their eye. There's actually a common cause for this, and it has to do with trigger points within your upper trap muscle. So we're going to go through those common trigger points, where they're located, and the anatomy of the upper trap, along with some treatment solutions and things that you can do to help solve that problem. So to better understand trigger points in the upper trap, we need to know where it's at. So the upper trap will actually originate up here at the base of the skull, and then it works its way down, and then it inserts again here over at the tip of the shoulder, and then it also has some attachments at the spine. It has two other portions, the mid trap and the lower trap. We're not going to really focus on those today because that's not the most common spots of trigger points that we see. So with the upper trap, those are the attachments. This muscle tends to get overloaded oftentimes because it's carrying the brunt of the load, the weight of your neck, and it operates to shrug your shoulders. So when this muscle gets tense, it gets tight, it develops these muscle knots called trigger points. There's two types of trigger points. One is called an active trigger point, another is called a latent trigger point. A latent trigger point is where you push on a spot and it's just tender, but the pain doesn't move anywhere else. An active trigger point, however, is a spot where you push on it and it refers elsewhere. So for example, there's two common spots in the upper trap that have active trigger points. And if you apply enough pressure to them, they can refer pain up the neck, around the head, and then even back behind the eye. So any of those spots that are considered active trigger points are ones that we would consider treating in the clinic. And we'll talk a little bit about some of the different modalities and treatment techniques that we use to help get rid of these trigger points for our patients who have headaches, neck pain, and jaw pain. So we have a number of different ways that we solve these trigger points. So some of the things that we do to treat the symptoms in the meantime, while we're getting stronger and building up that layer of strength to get rid of them once and for all, is we will either do some soft tissue work, which we'll demonstrate a technique here in a moment. We will do some dry needling, or we'll do some cupping to the area. From a dry needling standpoint, we find the trigger point and our goal is to go into it with the needle. From a cupping standpoint, our goal is to get over the top of the tissue and move the cups and glide them along the tissue if we can to try to loosen up some of that tissue and provide some pain relief to the patient. The soft tissue technique that we'll demonstrate is called ischemic compression. What you're going to do is you're going to go to those spots within the upper trap and you're going to find one that if you push on it, it refers pain somewhere up into your neck or around your head just like that. If it goes to any of those spots or anywhere other than where you're applying pressure, then you're going to hold on to that spot. So you want to basically find the tissue, apply pressure, and you're going to hold that pressure for about a minute to 2 minutes. And you're just going to stay in that position. Continue to apply pressure. You're going to feel that pain radiate, but as you start to hold it longer and longer and longer, the pain should actually calm down and the radiating symptoms should start to simmer. What you're actually doing is you're decreasing the blood flow to that area for a short period of time. When you release that pressure, new blood flow comes into that area and helps to supply that area with a little bit more healing nutrients. It's a technique called ischemic compression and it works great for short-term pain relief. So if this is something you're struggling with, please let us know if the soft tissue technique helped you. Stay tuned for more tips from the head, neck, and shoulder specialists. If you have any questions, drop them in the comments below.